wrap up this series on skin pressure injuries by talking about some special considerations for people with intellectual and developmental disabilities. So, a lot of times people with IDD are on medications that can be sedating. When someone is sedated, they're going to move less. So we should really think about the medicines a person is on and is it impairing their movement in some way. So always review the person's medicines and try to ensure that the person really needs the medicine that they're on and that they're not having side effects that could be a big problem for them. So again, looking at different diagnoses, making sure we are aware of different conditions like, again, spasticity or paraplegia, all of these, the conditions that can increase the risk for pressure injury. And so know the clinical conditions that might put someone at more risk and be aware of those types of things. Looking at assistive devices that they might be using as well as a potential cause of some sort of skin pressure injury. Always monitor a person's skin. Again, sometimes these things may not be painful and they may not be able to indicate that there is something wrong, that there's something hurting, that there's something bothering them. So we need to do a regular, a routine monitoring of the person's skin, looking everywhere for potential injuries. We have to remember that communication is so important for all of us, including as a support staff. We need to make sure that we communicate what's going on to the entire support team so they know what if a person has an increased risk or if they're having a particular problem as well, so that everybody's on board and understands the treatment and prevention plans for skin pressure injuries. And we know that people with IDD rely on their supporters many times for many different things. So make sure everyone who supports people with IDD understands the potential risks of skin pressure injuries, what to look for, what to do, and how to prevent them. Again, you can find a lot more information about this by downloading the Skin Pressure Injuries document at replacingrisk.com.